Hello and welcome to Unstress. I'm Dr Ron Ehrlich. Now, being a health practitioner brings with it huge responsibilities, and every single practitioner I know takes those responsibilities really seriously. Now, I'm in a very fortunate position to work in a group practice, and people come up to our surgery in the centre of the Sydney CBD, and it's beautiful space. We're very proud of it. It's a great environment in which to work. But the best part of our practice is something which very few people see or experience. It's the five of us dentists share an office, and we share our clinical experiences and our observations. And we do that regularly, and we mentor each other and we advise each other. It is terrific, I have to say. So my guest today is one of those partners, Dr. Lewis Ehrlich. And Lewis got the academic medal at university, and he is an outstanding clinician. Apart from being a great dentist, he's a holistic health coach, he's a qualified personal trainer, a former professional football player, soccer, and he's literally grown up with all these things we discuss on the show, on the whole podcast. Now, oral health is becoming a big issue. It's actually always been one, but governments and other health professionals and many in the public are now realising an amazing fact. Yes, it's apparently a huge breakthrough in healthcare. The mouth is connected to your body, and most importantly is being recognised as the gateway to good health. Well, who would have thought? Actually, we did many, many years ago, but here we are. Now, there's been a lot of publicity lately about oral health because of, in Australia, what's called the Oral Health Tracker. Now, this was developed in collaboration with the Australian Dental Association, the Australian Health Policy Collaboration, and quite a few leading Australian oral health experts. The Oral Health Tracker highlights the link between oral health and preventable chronic diseases such as diabetes conditions and lots of other conditions and their risk factors. It's a national report card that sets out oral health improvement targets for all Australians. And the tracker shines a spotlight on our current national oral health status, which isn't all that impressive, I have to say, while encouraging everyone, especially the nation's leaders, which definitely need encouraging, to work towards effectively addressing the oral health burden in Australia. It is huge. Interestingly, in the USA, the Surgeon General's report in 2018, or it may have been late 2017, highlighted almost for the first time the importance of oral health. That's 2018. Oral health's been an issue for quite some time, and made the point, very importantly, that oral health and general health were inseparable. So this was a great opportunity to take you into our back office, more or less, and share this conversation I had with one of my partners, Dr. Lewis Ehrlich. I hope you enjoy this conversation I had with Dr. Lewis. Welcome to the show, Lou.
Thanks for having me on, Ron.
Lou, here we are talking about our World Oral Health Week. Oral Health Day was only, middle of March or end of March, and it was pretty big this year because the media got hold of a lot of statistics that were pretty alarming. What do you think?
I thought it was very, very alarming, shocking actually, but a little bit unsurprising from what we see day to day as dentists as well.
Yeah. Although our practice is in the city, but even in the city of Sydney, but even with that, we're kind of sometimes surprised, aren't we?
Yeah, we are. We live in a little bit of a bubble there. But having said that, some of the statistics are pretty alarming. You know, we've got, 51% of people not brushing their teeth.
At all.
Twice daily.
Twice daily. Yeah, but even twice daily.
Yeah, which is crazy. I mean, if you think that people will line up for a coffee 2, 3, 4 times a day at, 5-10 minutes a pop, and yet they can't find, the 4 minutes that you need to brush twice daily, for 2 minutes. It's a problem.
Yeah, and it's reflected in statistics too, because they say tooth decay is the most common chronic disease in Australia. And I think I got asked this question recently, have we been lulled into a false sense of security because water is fluoridated and therefore tooth decay has been eradicated?
Yeah, well, I mean, quite the opposite from these statistics. And, if I look at the last week, I actually saw 2 new patients in a row that didn't have any tooth decay, and it made my day because it is so, so rare.
Yeah. Well, we're going to talk a lot about about different aspects of oral health and some pretty alarming statistic. But the thing that amazes me is, given it is the most common disease, chronic disease in Australia, the Australian government actually only spends 2.1% of its health budget is dedicated towards dental care. It's almost like the mouth is not connected to the rest of the body.
Yeah. Well, I mean, and that attitude from the government standpoint is kind of the attitude that the individual picks up on as well. So if they're not
not covered in Medicare, then it can't be too important anyway.
Yeah, and I think that, that rubs off on people, and that could be one of the reasons why people aren't showing the enthusiasm to their oral hygiene.
Now, I know I've been asked this question a lot over the years, but what is the difference between a holistic dentist? I mean, what do you think the difference? How do you answer that question, Lou?
Well, I think that you've got to look at the person connected to the tooth and gums, not just the teeth and gums themselves. And, if you're talking about tooth decay, you have to look at not just oral hygiene, you have to look beyond that, and you have to think, what is this person consuming? Food, drinks, how are they breathing, how are they sleeping, are they stressed? All these sorts of things come into, a holistic style of thinking. And I think in our practice, given the way that we do practice, with those things in mind, I think you get better health outcomes. And as a general rule, we probably see a little bit less decay than perhaps other areas when you're looking at a little bit more globally or holistically.
Yeah. Well, the other statistic is that poor oral health in childhood is the strongest predictor of dental disease in adulthood. Well, that's not entirely surprising, is it? I mean, if you've already got decay as a kid, you're set on a path because you need to have the decay fixed. You've got to have fillings done.
Yeah, and the disappointing thing with that is that when you see parents that bring their children in and they actually do have a lot of decay, the attitude is that, they're just baby teeth, and they'll get a new set anyway, and as a result it doesn't really make a difference, but it sets the tone for the rest of your life, and the statistics show that. So to just throw it away as something that doesn't matter is not really the right attitude. Rather, it should be a warning sign that things need to change, and they need to change quickly so that they can set themselves up for better dental health, but better health outcomes generally as well.
Well, I mean, I think we've often commented on this, that if the hardest things in your body, teeth, decay because of what you eat, what's going on in the rest of the body, and you don't actually have to wonder about that because you just have to look at the statistics of chronic disease. I mean, people think of oral, I think part of the problem, and we'll talk about this later too, that if you're not in pain, you're fine. But oral diseases kind of fall into three broad categories. Do you want to share that with, because people just think if they're not in pain, they're fine. But there are other issues here, being tooth decay, gum disease, and oral cancer. And we're going to talk about each of those in a moment. But this also, getting back to, and this statistic is really coming to us from the Australian Dental Association and the Australian Health Policy Collaboration. And I think the ADA actually do a fabulous job. I really do. They advocate for oral health for the community and try to elevate it to a level that it really should be at. And that's part of what we're doing here today. But the reason this has received so much media attention is because they've put together what's called the Oral Health Tracker. And it's a fabulous resource for health practitioners and the public. And we're just referencing some of these statistics. These aren't statistics you and I have come up with. This has come from us from the ADA, and we just thought we'd shoot the breeze a bit with it. But what about this other statistic about, now hang on, it was about, go on, you share it, because
so
it just
only 10% of adults that are 15 years or above are decay-free.
Yeah, have no cavities. That's why you were so impressed with your new patients you saw this week. I know you came into the office and you said, it's just made my day. I've just seen two patients that have absolutely no decay. They are in almost perfect oral health.
Yeah, so rare to see. It really shouldn't be that I have to come into the office and tell all the other dentists that
you've seen something exceptional.
That I've seen something exceptional, but unfortunately that's the case. And going back to what you were saying, if the hardest substance in the body is decaying, it's scary to think what would be going on. And it's also scary to elsewhere in the body is what I meant to say. But it'd be scary just to think that is such an exception, that it's actually mind-blowing that is so normal that almost every patient that I see in what would be considered a bit of a health bubble, you would almost call it. A lot of people are in tune with their health. A lot of people seek out our practice because it's a health-orientated space, etc. And we attract like-minded people as a general rule. To even see that as an exception in our practice is scary.
And to put that statistic another way, that means 90% of the population over the age of 15 have experienced some decay in their permanent teeth. 90%. And actually, there's another statistic a little further on that we looked at in America, which confirms that, and we'll come back to that also. But the other one we talked about is gum disease.
Yeah. 20% of adults in Australia aged 15 and above have some form of gum disease.
Yeah, now just to give people a little bit of gum health 101 here, the gum should be like a really tight collar around the tooth, and there's a crevice between the gum and the tooth. And if you measured the depth of that crevice, it should only be about 2 to 3 millimetres deep. It should be pink, it should be firm, it should be healthy, it shouldn't bleed when you brush or floss. If that crevice goes deeper and actually becomes a pocket, that starts to impinge on not just the gum that you can see, but the periodontal structures that support the tooth to the bone. So that's why a periodontal pocket over 4 millimetres of depth affects 20% of people over the age of 15. But as we will see, as you get a little bit older than 15, and not that much older than 15, it gets even worse than that.
Yeah, and I mean, a lot of people would see bleeding gums and think, oh, well, it's no big deal, it's just bleeding gums. But, like we say to our patients, if you take the surface area of your gums, it's about the size of your palm, and if every time you washed your hands, your palm started to bleed, you'd be in a state of panic. But often we just turn a blind eye when there's a bit of bleeding from the gums. But what that's actually showing is that there's chronic inflammation in the body, and gum disease is no laughing matter. It's basically linked to heart disease, diabetes, stroke, rheumatoid arthritis, breast cancer, pancreatic cancer, preterm births, low birth weights, erectile dysfunction, poor sperm motility, quality, the list goes on. So if you're not taking your gum health seriously, you're not taking your health seriously.
Yeah. And as you say, a lot of people kind of will floss their teeth, and they'll get some bleeding, and they'll think, I might just not floss my teeth for a while, and that seems to be the problem. And again, using the hand as an analogy, if every time you washed your hands, the cuticles of your nails bled, you wouldn't go, oh, I'll just stop washing my hands for a few days and the problem will be solved.
It's a reason to keep going.
It's a reason to keep going and focus. And the common denominator in all those diseases that you just mentioned is chronic inflammation, of which the gums is the most common. So that's a pretty alarming statistic. Well, here is that question again. How common is gum disease? And this came from an American study. This didn't come from the Oral Health Tracker. But how's that for a statistic? 94% of adults in the United States have some form of gingivitis. That means the gums, that more superficial part of the mouth, the pink stuff around teeth, that's gingiva. And when that bleeds or is puffy, that's called gingivitis. And 94% of the American population, and I would suspect that would be true in Australia too, of the adult population have this more superficial gum inflammation, chronic inflammation, gingivitis.
Yeah. Well, I mean, again, doing our new patient examinations that we do, we check the gums, and it's definitely the exception, not the rule. If you see a bit of healthy gum tissue that doesn't bleed.
Yeah, and the more deeper problem of periodontal, so you've got gingiva, gum, that you can see, but the part that joins the tooth to the bone is called the periodontal ligament. So that's what periodontal disease is all about, that it goes deeper. That's a pretty alarming statistic. Go and share it with our listener.
Well, yeah, in American adults, it's almost 50% have deep gum disease. And for adults over 65, it jumps up to 70%. So you think about all those systemic diseases that I previously mentioned. If you want to try and reduce your risk of those things, then you'd want to see that figure a lot lower amongst our population.
And back to tooth decay, and this is another study that we were talking about recently that said 92% of adults aged 20 to 64 had some experience of tooth decay in their permanent teeth. Tooth decay being the most infectious, non-communicable disease globally. But you actually said something the other day when we were talking about that young patient. There was a young patient that we heard about. Share it with our listener what this story was.
Well, we had a 4-year-old patient that came in to see us and basically was told that she has 8 holes and needs to have a general anaesthetic to have them treated.
And the mother was quizzing us as to, they said they're on a healthy diet. They are on natural toothpaste. They didn't use fluoride toothpaste, but they presumably did drink fluoridated water. And they was kind of coming to us searching for there were definitely cavities there. And with kids at that age, you do need to put them under general anaesthetic because you just cannot sit a 4-year-old kid down and do the complicated work that is involved in that. And they were searching for other answers, and we kind of shot some ideas around what could be some other reasons. Let's share with our listener what some other reasons for that level of tooth decay might be.
Well, one interesting one is that you can actually leave your child susceptible to dental decay if you yourself have the bacteria in your mouth that causes dental decay. So it's actually transmissible. It can be transferred from, caregiver to child. If you've got a lot of decay in your mouth and you're sharing spoons
or gum disease for that.
Yeah, or gum disease. If you're, sharing spoons, kissing your child, and I'm not saying that you shouldn't shower your children in love, but you've got to make sure that your oral health is in tip-top shape if you do want to reduce their risk of gum disease and tooth decay. So tooth decay is a transmissible disease according to recent research. So a lot of people don't know that.
And there were a few, I kind of raised the one that a lot of people aren't aware of, and that is if you are gluten intolerant or sensitive, like the extreme version of that is a celiac, where you just literally cannot eat any gluten. But there is a lot of non-celiac gluten intolerance, and that affects your ability to absorb minerals effectively, and that affects the quality of tooth structure, making you more susceptible to decay.
Yeah. So you want the tooth structure to be really hard, and it should be 10 times harder than bone. And if you've got that gluten sensitivity issue, it can make the tooth structure soft and more susceptible to holes, and that could be another reason potentially why this child has ended up in the situation that she finds herself in.
We also offered an opinion on breathing.
Yeah, so we're meant to be breathing through our nose. Noses are for breathing, mouths are for feeding. And if you don't do that, what you can do is a range of things. We could talk about this for hours, but
let's just give it a quick overview.
But one of the issues is that you also dry out your saliva at night time, and that's a protective mechanism in the mouth to prevent tooth decay. So potentially this child was. What I saw was breathing through her mouth, and that's basically drying out the saliva, but also shrinking her airway as well, because her upper and lower jaws will be nice and broad if the tongue is at the roof of the mouth. If it's not there and it drops back into the throat, not only do you get a poor quality sleep because breathing's affected and potentially start grinding, but not good for the shape of the upper and lower jaws and sinuses.
Yeah. A lot of people see spaces between their baby teeth and think, oh, no, that's not a good thing. But actually we look at it and we can say, if there are spaces between the baby teeth, then you have probably got enough room for the adult teeth. If the baby teeth look just fabulous, aren't they all in a perfect line with no gaps?
Yeah.
We look at it and go, that kid is going to need orthodontic treatment. That kid has already got a narrow upper jaw and probably lower jaw, and that kid has got, therefore, a narrow upper airway.
Yeah.
So breathing was another issue.
Yeah, and, you're spot on. I see a lot of kids, and I've had numerous parents come in and say, there's so many gaps between the teeth, and that's another one that makes my day.
Yes, when you see that. I don't see that often.
You don't. And I come into the office and tell everyone that I saw a kid with space between their teeth, and that's
You've
brilliant.
got a lot of good news for us in the office. We wait for you to walk in and give us all the good news. But that is true. And, we've talked about this many times, and that is that if you looked at 95% of the population, they don't have enough room for all 32 teeth in their mouth that we've evolved to have. And if you've got enough room for all 32 of your teeth, then you've got broad upper and lower jaws, you've got enough room for your tongue, and you more than likely have a broad upper airway. If you don't have enough room for your teeth, then you have a narrow upper airway, and that predisposes you to a whole range of things. But we're not going to get distracted by that. We're going off on a tangent here. But we were talking about this 4-year-old kid and why they had such a high decay rate. So we talked about, well, we didn't actually get to do a diet diary on the kid, which we would love to do. And a lot of people think, a good diet what they consider a good diet may not necessarily be what we consider a good diet. But the gluten was one thing, the airway was another thing.
The transmission potentially from mother to child or caregiver to child is another one.
I think reflux was potentially another one. The kid, there could be some reflux to do with some food sensitivities, which brings acid into the mouth and causes that kind of, a lot of decay. That's a lot. Eight cavities in a 4-year-old kid is a lot of cavities. But it's a problem. I mean, tooth decay is a problem. And interestingly enough, when you are on a traditional diet, and there've been research done about this in the 1930s and I guess archaeological studies. I mean, there are some archaeological studies that do show tooth decay and oral health was a problem, but I would suspect that was in a nutritionally compromised area. But if you're on a nutrient-dense diet, zero prevalence of dental disease 10,000 years ago compared to 90% today, which is a pretty sobering issue. Now, the other one that comes up and a lot of people don't associate with a visit to the dentist is this one, oral cancer.
Oral cancer, it's on the rise. I think worldwide it's approximately the 10th most common cancer. And, one of the main reasons why people should attend the dentist and one of the reasons why avoidance is such a dangerous game to play is that we do an oral cancer check, and it's one of the most important checks that we can do as dentists to pick up on this potentially life-threatening disease. And there's 11 per 100,000 people. Yeah,
and it's higher in Australia because of our lips exposure to the sun. I mean, the causes of oral cancer are, pretty obvious.
Yeah.
And some not so obvious.
Well, I mean, it used to be a very common cancer amongst, and it still is, amongst people that are 40 years and above that have been smoking and drinking a lot of alcohol. So they're two of the main ones. A lot of people don't realise that they're actually co-carcinogens. We all know the people that are social smokers or what have you, they only smoke when they drink, etc. Now, that's a dangerous game as well because the alcohol dries the saliva out and then leaves the oral tissues exposed to the potentially damaging effects of cigarette smoking. So if you've got a friend out there that only smokes when they drink, should let them know that that's actually a dangerous game. But also we're actually seeing it in far younger people these days, which is quite alarming, and that's because of the human papillomavirus or HPV. And it's actually been shown to come as a result of oral sex. They're seeing a rise in oral cancers from young people performing oral sex.
Right. And of course, as I said, the sun's exposure to the lower lip in Australia elevates oral cancer. And in our practice, I mean, it only has happened probably 3 times in the last 5 or 10 years to me. One of them was a 53-year-old woman who had a very, very tiny ulcer on the side of her tongue, and it turned out to be a carcinoma, and the extensive surgery that resulted from that was really horrendous. I mean, you take your tongue for granted until you burn it, damage it, bite it, or actually don't have it. And that affects salivary glands as well. So if you think talking and speaking and chewing and smiling and
swallowing
are all important. So there was a 53-year-old and she had quite extensive surgery. Same story with the 23-year-old young woman, really shocked us. And then I had one case, which I mention in my book, of a 29-year-old guy that came in because he felt he had a loose tooth on a back tooth. And when I examined him as a new patient, every tooth on his right-hand jaw moved. And I had never seen anything like that before. And he immediately went off to our oral surgeon, and he was very quickly part of a very complicated surgery, and which actually removed his right upper jaw. Now, I don't want to gross people out, but that is the seriousness of oral cancer. And we are saying, we routinely, as you say, we check, and I'm sure everybody's dentist does this as well. You routinely check the lips, the tongue, the cheeks, the palate, the roof of the mouth, the back of the throat, and the glands under the jaw. And that is just a standard 6-monthly oral cancer screening that I'm sure absolutely every dentist does. So that is another reason for going to the dentist and having them check you out very thoroughly. We talked about pain being a barometer of health or not. Kind of people think if they're not in pain, they're okay. How's this for a statistic? Go on. Share it with this.
Adults who reported toothache in the last 12 months, 16.2%. Yeah. So that has to be, the tooth has to be in a bad way for you to get a toothache, because like you were saying, you can have a cavity and it doesn't cause any pain whatsoever until it's quite far gone. So that's quite alarming.
What percentage, we've thrown this around a little bit in our office talking, but what percentage of oral health problems, oral diseases, that is tooth decay, gum disease and oral cancer, what percentage of those displays as pain?
Very little.
What would you, go on, put a percentage on it. Well, I've got my own idea of what it is, so I would think, what do you think?
All you have to think about is how many patients come in to see you in pain, and that would be, I would say 2 to 5%.
Yeah, I think that's absolutely right. I think 95% of oral disease has no pain associated with it. And that actually surprises me, because in one day, and this happens to us all the time, in one day, like I had a patient a few months ago, a new patient that came in, and they were concerned about a little brown spot on their canine tooth. And I looked in their mouth, never having seen them before, and at the back of their mouth they had 6 teeth that were completely rotted down to the gum. Completely. And I said to them, and they were concerned about this brown spot, which, fair enough, I'd be concerned about it too. But I said to them, have you had any pain? No, I have not had a day's pain. I'm just concerned about the appearance of this brown spot on my front tooth. And then on the other hand, in those 1 or 2 out of 100 or 5 out of 100, one person comes in and yes, they have a cavity where they are in excruciating pain. So I had that happen in the same day, and I've been in practice for a fairly long time, and it still surprises me.
Yeah, there's no rhyme or reason to it.
There is no rhyme or reason. So the point being, if you're not, just because you're not in pain, good on you, but that doesn't mean you're anything to do with oral health.
It's a really bad barometer.
It's a really bad. Imagine, I often use the analogy to imagine if I went in to see my cardiologist, Ross Walker, who we interviewed earlier in this series, and Ross said to me, Ron, how are you doing? And I go, I'm fine. And he said, are you in any pain? And I go, no. And he said, well, mate, come back when you're in pain. And I'd be thinking, Ross, and I know Ross doesn't do that. Ross is a lot more thorough than that. Anyway, dental checkups, and this got a lot of publicity, didn't it? How often people actually go over the age of, go on.
Adults aged 18 years or above that have had a dental checkup in the last 12 months, half.
Yeah, and I think I've heard a statistic where actually half of the population haven't been for a dental checkup in more years than that. I'm surprised that was only in the last 12 months.
Yeah, well, one patient stands out for me. I actually had a guy who hadn't had a checkup since 1981.
Wow.
And this was...
How old was he?
Oh, he was 60.
Right.
And he... this was probably back in 2015, and he didn't realise that he actually had gaps between his teeth, on his lower front teeth.
Right.
Because they were caked in plaque.
Right.
So I removed the plaque, and he goes, oh, I've got gaps between my teeth. I never knew that.
Yeah, that's where the gum normally would sit, but this was full of calcium. Oh,
Yeah.
mate, anyway. Now, part of this oral health tracker also, and again, let's give credit to the ADA and the Australian Health Policy Collaboration, because these are amazing statistics and they need to be out there, and it's why we're doing this show today. Australia's children and young people, let's just look at a little bit of that. This is pretty scary. I mean, children 5 to 6 years old who have experienced decay in their primary teeth, 35% of kids up to the age of 5 to 6 years old have had some decay in their baby teeth. I mean, come on, give us the rest of it. It's pretty shocking.
Untreated tooth decay, children 5 to 10 years is 27%.
Yeah. Now, you actually told me a very interesting statistic about days lost. Share that one with we talked about 600,000 school days lost because of oral health problems.
Yeah, I mean, the ADA a few years ago released a document basically with estimates on how much productivity is lost due to oral diseases, and they estimated there was 600,000 school days lost annually because of tooth-related issues or pain or treatment. And you think about how many days of lost learning that is across our community. It's, they're missing out on valuable education there.
I mean, I know we're talking about younger people, but going back to adults, I think there was another incredible statistic, which was something like 1 million days of working days were lost because this was the ADA's assessment.
Yeah. A million days across the country.
Across the Australian population.
Just the Australian population due to tooth-related or, oral health-related issues.
Look, we're bombarding people with statistics, but when you look at younger people as they get older, 6 to 14 years, 25% basically have decay already at that stage in their permanent teeth.
Yeah, I mean, I had a patient who literally had just got his adult premolars. He'd had it in his mouth for a year and he already had a massive hole. And you just think, how does this happen?
Yeah. Early childhood dental visits. When do you think? When should a child first come?
Well, I think the ADA released something that said that you should check their teeth when they first come out, but that might be a little bit impractical. So probably somewhere...
You mean professionionally?
Professionally.
Yeah. Well, maybe that's a good way, with a baby, you're just in there and you're counting your teeth. I mean, I'd sort of encourage the patient to come in with their child rather than make a separate appointment. You're looking in there to, you know what I mean? Not make a big deal of it, but yeah.
Yeah, I mean, practically speaking, around sort of 2 to 3 is probably a good place to start. Yeah. Get them in some good early habits, make it a positive experience from day one, and set them up for a lifetime of good oral health and not a pattern of avoidance, which unfortunately a lot of people do.
Yeah, and I think for parents, you can actually look in a kid's mouth and you get a pretty good idea. If there's discoloration or staining on a tooth, then there's probably a problem there. So it's definitely worth looking into at that point. We talked about lost school days, but there was a part of that same report was also, you said 600,000 days were lost in school, but there was also in part of that report loss of productivity. Can you share that with our listener?
Yeah, so lost productivity based on tooth-related discomfort has been estimated at about $2 billion a year. So, if you want to do the right thing by your country, you really should be staying on top of your oral health and visiting the dentist regularly and being proactive rather than reactive.
Yeah. Another form of economic rationalism.
Exactly.
If there's no other reason, do it for the country.
Exactly.
And go and get your teeth checked so you don't, lose productivity. God, we would not want productivity to go down. That would be just absolute disaster.
Dental health meets economics.
So, Lou, just finishing, if you had to give our listener, now they're totally focused. I mean, I can just imagine people are reaching for their phone, about to ring up and make appointments to go and visit their dentist and check. Well, what are some of the tips you'd leave our listener with, oral health-wise?
I think eating nutrient-dense natural foods is very important, sort of non-negotiable. Avoiding things that are in packages or with an ad on TV is generally a good thing to avoid. Brushing regularly, which is, twice daily for 2 minutes, which half the population aren't doing. That's a no-brainer, but also visiting your dentist regularly as well, not leaving it years and years and years between visits, because you got to get on top of, things like chronic inflammation, tooth decay, etc., and they're often not painful.
Yeah, I think we've kind of been lulled into this false sense of security with this idea that water fluoridation has eliminated tooth decay, and this statistic clearly shows it hasn't. And you kind of think, well, decay rates have definitely gone down since I was a kid, for sure. And you look through the entire world, fluoridated and non-fluoridated countries, decay rates have gone down. And I think the reason for that is people have focused on brushing more than they used to, but clearly are not doing it enough. And I guess the other message was that don't wait for pain, because it's such a poor barometer of health. Just finishing up now, taking a step back from your role as a dentist, what do you think people's biggest challenge is today on their health journey through life in our modern world?
I think confusing health messages. People really don't know how to sort through the bombardment of information that they get on a daily basis, and it's all conflicting. But I think if you go back to basics, eating natural, healthy foods, prioritising your sleep, prioritising your oral health, which is a little bit biased, I know, but it's very important, moving your body regularly. I think if you start with those things, then you'll be a lot healthier than you otherwise would if you weren't doing those things. So getting back to basics, not getting too caught up in the confusion, really, I think that's a really important thing.
Fantastic. God, you couldn't tell you're part of my family, could you? Lou, thanks so much for joining us today.
Pleasure, Ron.
So there it is. Some pretty disturbing stats, and when you dovetail that into this epidemic of preventable degenerative diseases we have in our society, it doesn't matter whether we're talking about cardiovascular disease, cancer, name a body part and there's a cancer to go with it, affecting young and old alike, allergies, diabetes, autoimmune conditions, of which now there are over 80, mental health and more. So we're going to be doing other shows on various other aspects of oral health. I list dental stress as an important stressor, and with good reason. Some of those issues will be the root canal issue, chronic tension headaches and neck aches, which people often don't associate with their oral health, but clenching and grinding is very intimately connected to those. As I've said, if you're not taking oral health seriously, you should, because your body already does, and don't wait for pain. Now, we'll have links to Dr. Lewis Ehrlich's webpage. He's written some great health articles and is definitely worth following. We'll also have links to the Oral Health Tracker, the US Surgeon General's report, which makes fascinating reading. Folks, now listen, I'm a dentist, so I've got to say this. Don't forget to brush twice a day. Apparently, 55% of the Australian population don't do that. So please, if you're a listener to this program, make sure you do. Floss once a day, and most importantly, feed your friendly bacteria, your oral microbiome and your gut biome, not your unfriendly bacteria, by eating a nutrient-dense diet and drinking clean water. Are you feeding your friends or your foes? And more importantly, most importantly, don't wait for pain. Remember, at least 95% we think of oral health conditions do not have pain associated with them. So visit your dentist. Find out if you do, or to what extent you do, have any oral health issues. Remember that not much can go wrong in 6 to 12 months, usually. And if you haven't been in for a while, well, go. So with that in mind, until next time, and this is Dr. Ron Ehrlich. Be well. This podcast provides general information and discussion about medicine, health and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express